cause of breast cancer is a genetic mutation that occurs in our genes, in the DNA. Now, there are many things that could cause that. The concept is that there are many things, not just one step. Cancer, production of cancer, which is called as carcinogenesis, that whole process, sometimes can take decades to happen. So it's a multi-step process. Many things combine together to create this cancer, and all of these things are called as co-carcinogens, which means these are cooperative different agents which cooperate with each other, confabulate with each other, and over a period of time, with multi-step process, create cancer in an individual. Apart from lumps, you see, lumps is a very misleading thing, because I can tell you that almost 90% of the lumps that are reported by women are benign lumps. They are because of glandular enlargement, because of benign enlargement, because of hormonal variation, because of many other things, inflammatory processes. But the 10% lumps which are bad are the ones which could be carcinomatous, but a lump is the most common way in which it presents, but not necessarily the only one. For instance, a nipple on that side, which was normal and protruding outwards normally, if it recently becomes inwards, if it goes in, it gets drawn in, which means something sinister is pulling it down. Usually a cancer does that. So, in a recently indrawn nipple, only those nipples which have been indrawn for ages. Some people are born with indrawn nipples, but most are not. But in those where it was normal, but suddenly over the last couple of weeks, started going in, is a sinister sign and needs to be looked after for. And the other thing, blood from the nipple. When discharge from the nipple discharge is again a very common condition. Mostly benign and inflammatory disorders that I talked about earlier are responsible for that, and this is the glandular cells coming out through the ductal system, the milk ducts comes out. But if it is red, the color of blood, not brown, not greenish brown, not dirty, not milky, if it is red, the color of blood, and that means there is probably a small tumor within that duct which is bleeding. And so that is another way. Now, or if the breast shape alters, there is a dimple which comes on the skin, which means there is something inside which is drawing the skin of the breast anywhere, in any of its quadrants, inwards. Cancers do that a lot. So a recently created dimple, or an ulcer which is not healing, a wound which is not healing despite one treating it or over a period of time, is another sinister thing. Or sometimes through the secondary lymph nodes, you may not notice anything in the breast, and you notice that there is a lump coming up in the axilla on that side. That could be a secondary lymph node enlargement from a breast cancer. So it could present in that form. And sometimes, if it's a cancer and it has already gone to distant organs and it goes to the lungs, it can produce cough. If it goes to the brain, it could produce a convulsion. If it goes to the liver, it could get that feeling of vomiting. But these are very small percentages, but yet are varied presentations of breast cancer.